With the ageing of the global population comes an increased incidence of vascular disease. The measurement of ankle systolic blood pressure is an essential element in the assessment and monitoring of peripheral arterial disease. However, in some groups of patients, notably diabetics, the elderly and those with kidney failure, medial arterial calcification makes the wall of the lower limb arteries incompressible, and this measurement is impossible. In this case, systolic blood pressure can be measured in the toe, where there is usually less calcification. However, up until now, the devices available on the market have not favoured the widespread use of the measurement of toe systolic pressure because they are either unreliable or too expensive. To fill this gap, Attis Medical has developed an innovative solution, the Systoe, which opens up new perspectives in the measurement of toe systolic pressure by virtue of its reliability, ease of use and affordable price. The Systoe represents an ingenious application of infrared photoplethysmography (PPG) coupled to a unique algorithm developed and patented by Attis Medical. By means of a photoelectric cell, PPG detects changes in blood flow in the vessels of the skin. After 10 minutes of rest, lying down, the patient's brachial pressure is first measured so that later the toe brachial index (TBI) can be calculated automatically. Check that the patient's feet are not too cold. Take the Systoe out of its case. It is an independent unit ready for use. Place the occlusion cuff on the proximal phalanx of the big toe. Do not over-tighten to avoid blocking the blood vessels. Stick double-sided tape onto the sensor to ensure that it is in contact with the skin when the second cuff is placed on the distal pad of the toe. The tube should be positioned towards the heel. The sensor sends an initial signal to the screen. This signal may be pulsed or flat. Start the measurement by pressing the Start key. The occlusion cuff automatically inflates to a preset pressure, in this case 250 mm mercury. Once the target pressure has been reached, the cuff automatically deflates at a steady rate. The Systoe precisely measures the cuff pressure at which arterial blood flow resumes, as detected by the sensor. This is the systolic blood pressure. At the end of the procedure, the toe systolic pressure is displayed on the screen. A cursor positioned automatically on the plot of the infrared signal shows the point at which blood flow resumed. If the brachial pressure was put in, the TBI is also calculated. The measurement is repeated on the first toe, and then the same procedure is carried out on the other big toe. This measurement is reliable, reproducible and accurate. The device is very sensitive, being capable of measuring pressures of less than 20 mm mercury. The Systoe system has been validated at the Vascular Testing Department of Nîmes University Hospital. The Systoe can also be used to measure systolic blood pressure in the fingers. After the procedure, the cuffs and the sensor are wiped clean. The Systoe can store results in its internal memory and details about the patient, and the toe can be input using the alphanumeric keypad. Results stored in the Systoe can be transformed to a PC for backup and printing. The Systoe's case contains the photoplethysmography sensor with its cuff, two occlusion cuffs of different lengths, a charger and special PC software. The Systoe's connection system is simple and mistake-proof to prevent misconnection. The Systoe substantially improves the reliability of distal blood pressure measurement. Its ease of use, together with the low cost of both device and the measurement procedure, make it the ideal system for screening for peripheral arterial disease, systematic monitoring of peripheral arterial disease, diagnosing critical ischemia, assessing wound healing potential in a patient with a trophic disorder. The Systoe is the fruit of all the experience of the ATTIS Medical R&D Department and its production workshop.